Today is August 26, 2025. A heart attack, or myocardial infarction, is a serious medical emergency. It happens when the flow of blood to the heart is suddenly blocked. Think of it like a plumbing issue. The coronary arteries are the pipes that supply your heart muscle with oxygen-rich blood. When a clot forms on plaque, the heart muscle downstream begins to starve for oxygen. This is a critical moment. Every minute that passes, more heart tissue can be damaged or die. Recognizing the signs of a heart attack can be life-saving. The classic symptom is chest pain or pressure. But symptoms can be subtle. Shortness of breath, nausea, lightheadedness, or pain radiating to the arm, jaw, or back. This variability makes public awareness essential. You are the first line of defense. Knowing the full range of symptoms empowers you to act decisively. If you suspect a heart attack, call emergency services immediately. Don't try to drive yourself. Once you arrive at the emergency room, a coordinated team springs into action to confirm a heart attack. The first test is almost always an electrocardiogram or ECG. Small electrodes are placed on the chest, arms, and legs to record the heart's electrical activity. Doctors also rely on blood tests. Damaged heart muscle releases proteins like troponin into the bloodstream. Troponin is sensitive and specific. Rising levels over hours indicate ongoing heart damage. A chest X-ray helps rule out other causes like pneumonia or a collapsed lung. An echocardiogram uses ultrasound to show how well the heart is pumping and where wall motion is abnormal. For a detailed view, a coronary catheterization or angiogram is the gold standard. A thin catheter is guided from the wrist or groin to the heart, and dye is injected to reveal blockages. X-rays show exactly where and how severe blockages are, and angiography often becomes the first step in treatment. ECG, blood tests, imaging, and angiography together give a clear diagnostic picture. If a heart attack is confirmed, treatment begins immediately. Next, the immediate treatments used to restore blood flow and protect the heart. When a heart attack is confirmed or strongly suspected, treatment begins right away to restore blood flow. One of the first medications is aspirin. It helps prevent the clot from growing. Powerful clot-busting drugs, or thrombolytics, may be given through an IV to dissolve the clot. Nitroglycerin widens blood vessels and eases chest pain. For severe pain, morphine may be used to reduce strain and anxiety. Beta blockers slow heart rate and lower blood pressure to reduce oxygen demand. ACE inhibitors and statins help protect the heart and manage long-term risk. If medications are not sufficient, an angiogram can transition directly into treatment, angioplasty and stenting. A small expandable stent is often placed to scaffold the artery open. For multiple or complex blockages, coronary artery bypass grafting, CABG, may be recommended. After procedural or medical treatment, cardiac rehabilitation is critical to rebuild strength and reduce future risk. Rehab includes supervised exercise, education, and counseling. Treatment saves lives, prevention reduces how often we need it. While medicine has advanced, the most powerful medicine is prevention. Avoid all forms of tobacco and vaping. Quitting reduces your risk almost immediately. Focus your diet on fruits, vegetables, whole grains, and lean proteins. Choose healthy fats like nuts and olive oil and limit processed foods, sugary drinks, and trans fats. Aim for at least 30 minutes of moderate activity most days, brisk walking, swimming, cycling, or jogging. Maintain a healthy weight, prioritize 7-9 hours of quality sleep, and manage stress. Get regular health screenings for blood pressure, cholesterol, and diabetes. Managing these conditions prevents heart attacks. Prevent infections. Get recommended vaccinations like the flu shot, which protect your heart by avoiding illness-related stress. By embracing practical daily steps, you build a foundation for a longer, healthier life. For more health tips, click the link in the bio, like, comment, and share.